Orleans East Hospital is highly decorated for their stroke care, and they are sharing their expertise with the community this weekend at a special event. It's called We've Got Spirit. And today, Dr. Cheryl Martin Shield, a doctor of neurology, is here to tell us all about what's going to be happening this Saturday. Welcome, doctor.
Thanks for having me.
Yeah, thanks so much for coming on to talk about this event because I love that you all are going right into the community to help them out. Okay, so again, the event is called We've Got Spirit, and Spirit actually stands for something. What can you tell us about the acronym and the purpose of this event this Saturday?
It does stand for something. So it stands for stroke prevention through identification of risk and initial treatment. Way too often someone comes to the hospital and they have a stroke, and that's when we discover that they have all these conditions that contributed to their risk of stroke. Our goal for this program is to target community members and empower them through identification that they actually do have risk and initiate behavioral treatments to get them started on their road towards stroke prevention.
It's so important. And at this event on Saturday, you all are going to be offering free assessments. Tell us about what that entails.
We're going to have several stations during which they'll be screening for blood pressure and heart rate and heart rhythm, as well as assessment of body weight and your body mass index, which many of us are scared to learn. Will there be assessments of the carotid arteries in terms of the blood flow to the brain, as well as actually insonating the blood vessels in the head to see how the blood is flowing through the brain, whether there's any areas of narrowing that pose increased risk for having a stroke later on. We'll also have assessments of lipids and blood sugar control, which contribute to risk. And we're going to have stations where you can learn about healthy, really delicious recipes, good substitutes for one thing that is not a great choice, and have something else which can substitute that is a great choice in terms of keeping your body and your brain healthy. And then we're going to learn some fun activities that really anyone can do to get their metabolism going, help with caloric burn, and get you on the pathway to working on this vehicle that you have that needs to last the rest of your lifetime.
And it's important that we know this because you all provided us some statistics that are honestly alarming. Listen to this, everyone. On average, someone in the U.S. suffers from a stroke every 40 seconds. Why is that, doctor? What is the biggest cause of strokes?
Well, the number one risk factor for having a stroke is high blood pressure. If everyone's blood pressure were normal, then about 50% of all strokes would be prevented. But most people don't know their number. If you don't know your risk, how are you supposed to address your risk in a healthy way?
That is so important. Not only are you all having this event on Saturday, like I said earlier, the New Orleans East Hospital stroke care team is highly decorated. Tell me about some of the awards that you all have won.
In 2021, New Orleans East Hospital received 2 American Heart Association Achievement Awards for their commitment to ensuring stroke patients receive the most appropriate treatment according to nationally recognized research-based guidelines.
Congrats on that. Since we're talking about strokes, I want to ask you, doctor, if someone is having a stroke, what do they do?
The first step is recognizing that you're having a stroke, and then the second step is responding. So in terms of recognition, the best way to remember the acronym for stroke symptoms is be fast, because I just told you, if you're having a stroke, you better be fast. The B stands for a sudden problem with balance. The E stands for any sudden problem with your eyesight. The F stands for any weakness or numbness involving the face, usually on one side. The A is for appendage, so any weakness, numbness, or clumsiness affecting an arm or a leg, usually on one side. The speech is any sudden problem with your speech. And the T is for terrible headache, and also to remind you of time, because every single minute matters during a stroke, and you should call 911 immediately for any of those sudden symptoms.
It's important that we know this information. Dr. Shield, thank you so much for joining us this morning, and thank you for doing this event. Appreciate your time. And remember, everyone, the We've Got Spirit community event is coming up this Saturday, March 19th. It includes free assessments, breakfast, and lunch. The event is from 8:30 a.m. until 3 p.m. at the New Orleans East Hospital. To RSVP, you can email noehspirit@lcmchealth.org. And for more information about everything they offer at New Orleans East Hospital, you can log on to noehhospital.org or pay them a visit at 5620 Reed Boulevard. Stick with us, everyone. We'll be right back.